Yeah, we're sleeping. How's everyone doing today? Hi, Lisa. We're going to have fun today, right? We made this limited on purpose. This is the VIP breakfast room.
No, this should be fine. I just need to put this on here.
First, I got to take my mask off. This is great. Chastity called and Troy called. They asked me to say stupid things today. And if anyone falls asleep or doesn't listen to Delray Medical, I will hit them with a racket. Right, Lisa? Okay? Nobody fall asleep. All right. Let's see if I get this right. My name is Ivan Barron. If I don't know you, I'm currently chairman of the Delray Beach Open. Vita Cost, the men's pro tennis tournament. Andrew, say hello. Andrew's actually one of our official photographers, so say hi, Andrew. I'm going to get to everybody, hopefully. If anyone doesn't know tennis, has seen tennis on TV, or has been to our event, thank you so much. We're going to ask you to please stand for the invocation and remain standing for the Pledge of Allegiance. I'm going to introduce Casey Adamski-Millard, Area Director of Sales and Marketing for the Boca Raton Marriott at Boca Center, Leadership Boca alumnus, the class of 2017.
Good morning and welcome. It is my pleasure to welcome you all back to our house, the beautiful Boca Raton Marriott. I have the privilege of delivering this morning's invocation. Please join me in bowing your heads and remain standing for the Pledge of Allegiance. Lord, thank you for this beautiful day and for bringing us all together. We thank you for your continued guidance through this difficult and uncertain time. We ask you to keep our loved ones safe and healthy. We pray for those who are ill and those who we have lost to the pandemic. May you lift up their families in their time of need. Please grant us the ability to move forward safely and to restore our businesses and partnerships responsibly. Please bless all of our heroic healthcare professionals, especially those here today, who continue to put themselves on the front lines to combat COVID-19. We are eternally grateful for your service. Finally, Lord, please bless this wonderful breakfast we are about to eat and the amazing team who prepared it. For all that we ask today and for our continued blessings, we are thankful. Amen. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
First, happy Valentine's Day to everyone in here. Hope everyone gets the greatest gift they possibly have ever dreamed of. My wife will yell at me for sure. All right, thank you for sitting down. I'm going to introduce the head table. To my far left, Troy M. McClellan, CCE President and CEO of Boca Chamber. Next, to my left, Michael Nornis, Group COO, Palm Beach Health Network, CAO, Delray Medical Center. On my far right, I indicated this morning, Casey Adamski-Millard, Boca Marriott. Next to Casey, Michael Daskell, Managing Partner, Daskell Bolton, LLP, Chairman, Boca Chamber Board of Directors. Next, Jeffrey Newman, MD, FACS, Medical Director, Cardiothoracic Surgery, Delray Medical Center. If anybody gets ill, we're going to be covered today. Next, Brisbane, MD, FACC, National and Florida Medical Director for Cardiology, Dependent Healthcare. Now for the VIPs. Everyone's a VIP. Michael Daskell, Daskell Bolton. President and CEO Secretary Troy McClellan, Boca Chamber. So many. George Rizzuto, West Boca Medical Center. Ron Wachowski, Boca Raton Marriott. Where's Bill Hager? Bill Hager, Insurance Medical Corporation, former state representative. Ambassador Councilors, committee chairs, John McCloskey, Leading Edge Mortgage Corporation. Economic Development, Constance Scott, Director of Local Relations at FAU. Council Member Andy Thompson. Where's Andy? Vice Mayor Commissioner Robert Weinroth, District 4. Okay, and Constance Scott, candidate, Boca Raton City Council, seat C. And Ryan Stenberg, Boca Raton City Council, seat D. I'd like to go ahead and introduce again, it's American Heart Month, so hopefully everyone has a great month. Happy Valentine's Day. And before we start breakfast, I'd like to go ahead and ask Michael Daskell to come to the microphone for any comments he may have.
Thank you very much to the Delray Medical Center and graciousness today, and stay with us.
Put the mics on.
Pardon me?
It's better.
Sorry about that. No, I can't do all over again. Troy posts his CEO messages every Tuesday, Friday, so take a look at the app. He says he gives tips on living, working, playing, and having fun and book with us. Live, work, play. There we go, I forgot that. We're all lifelong learners. So that's about it. And lastly, thank you to our staff for doing a great job. They have a very select staff there, and they work really hard for these events and everything else that the chamber does. So, Royce, Eric, Cassidy, Chris, everybody, thank you guys very much.
I'll echo Michael's comments. We're the event business, so what you see behind, or excuse me, what you don't see behind the scenes is beyond a large amount of work that Chastity and Troy and Sarah and all do. This is what we do. We live. It's ridiculous how hard it is to put on an event, whether it's 50 or 10,000. So just kudos again, because it's not easy. And kudos to all y'all for coming, because we just held an event with 14,000 with separations and sanitations. Delray Medical's working, I'm sure, their tails off to make things happen, to get some normalcy in here. So congrats for coming in every step of the way, just baby steps. You know, look at 70, 80, 90. All right? Guys, enjoy your breakfast.
All right, ladies and gentlemen, I know you're enjoying the delicious breakfast provided by our friends here at the Boca Raton Marriott. And enjoying the company of your friends and colleagues, and maybe for some of you it's the first time you've done it. I heard that this morning. Raise your hand if this is the first time you've went to an in-person meeting in a wicked long time. Well done. Congratulations and thank you for coming out. We certainly appreciate it. Along with Chairman Daskell, I welcome you to our February breakfast. It's always about heart health. Delray Medical Center has been our sponsor now. We love it. We've got two amazing doctors who are going to talk about that. We're going to hear about all the great things that Delray Med's doing. And so we welcome you and thank you for being here. As Chairman Daskell mentioned, this is the third breakfast, in-person breakfast we've had in a row. Raise your hand if you've been to all of them. December, Gene. Oh, nice. Thank you. Good job. It's good to see Councilman Thompson, Vice Mayor Weinroth, electeds coming out and supporting us as well. So we appreciate that very much. I also want to thank Ivan and congratulate Ivan on an amazing term. Who went to the tournament last month in Delray? Okay, we got to do a better job next year. But I've done a great job in dealing with date changes and what the pandemic has done. But flawlessly executed and well done. So congrats and thanks for being our MC today. We certainly appreciate that. I want to just recognize a few others. If you are an ambassador, please stand. Ambassadors have a kind of a blue label. The ambassador role is important no matter what, but certainly during this time they play an even more critical role in continuing to connect you to other members and keep you connected with the chamber. So ambassadors led by John McCluskey, thank you very much for that. And then if you're a new member or a newer member, and maybe you're wearing a badge that has a red stripe, stand up so we can give you a big round of applause. Welcome. Thanks for being a part of this organization and our chamber. I also want to recognize Bill Hager. He was introduced during the VIP. Bill Hager. This guy, I mean, I can talk all morning about this guy, but he is a past chair of this organization. And he was actually, when I started in this organization a few years ago, he was my first full year chair of the board. And has had an amazing positive impact on my life and career. But he served us on the Boca City Council. He served us in Tallahassee in the state legislature, and it's just an amazing. He was the CEO of one of our major employers in this community. It just has been amazing. Bill, it's so good to see you. Thank you very much for being here. And so, as I mentioned, Delray Medical Center always sponsors a breakfast. They're here with us at Heart Health Month. And I see, for those of you that did read my CEO message, when I invited you to wear red, if you read that, Vice Mayor Weintraub, I'm looking for your red. You were going to be, and you're usually much better at that. But thank you for that and for reading that message. We do try to put in a lot of critical and pertinent information to help you kind of get through it all. So, and if you read that and you have any suggestions of some other content you'd like in there, please call me. That's what we'll see what we can do. We try to get it in there. But we are going to hear from Delray Med, and we're going to hear from the docs this morning. Clearly, we're going to have to be efficient because Dr. Newman may have to rush right into surgery. He's ready to go with the outfit, if that's the case. But I just want to make just a few announcements of some things coming up in the community and with our organization. So, Festival of the Arts Boca, which has been running for 14 years now, is going to return, but in a hybrid version. It's going to run from March 6th to 14th, and they're still going to have some amazing talent, but if you're going to be able to live stream it, they're going to have, if you maybe recognize some of these names, Nadine Sierra, who's a Boca native and a Met opera sensation, a jazz flutist, Nestor Torres, a name you might have heard, and other really cool talent. And they're going to be streamed from really cool locations here in Boca Raton. So again, March 6th to the 14th, and I encourage you to participate in that. Also, you were introduced to two special people that are here this morning that are willing to step up and serve, or in one case, serve again. And that is Constance Scott and Bryce Lindbergh. These two folks, as Ivan mentioned, are running. Constance has already served our community and is willing to serve again. And Brian would be for the first time in this capacity. They've both been serving our community in many different capacities for many years. And the Chamber's pact is strongly behind their two candidacies, and we've got to get Constance back on the council, and we've got to get Brian to join her up on the dais. So, Constance and Brian, thank you for putting yourself out there and wanting to do it again. We're strongly behind you, and I encourage everybody to vote. If you haven't voted already by mail, to vote on March 9th, right? Critically important that you do that. You hear me say it time and time again. And these two candidates are going to be the two people that are going to continue to be sensitive to the needs of the business community. They're going to continue to move Boca Raton forward in a positive way, and they're going to keep the quality of life that we deserve and expect here in Boca Raton. So vote on March 9th. Thompson Scott, CC, Brian Sandberg, CD. You may hear me say that a few more times before March 9th, but just want to be clear about it. The other thing I want to just mention is sort of on the advocacy legislative side of the House is a couple of bills that are going on in Tallahassee that we're fighting for. You heard me mention it last month, and you heard me mention it again next month. And that's some liability protection legislation to protect businesses against COVID lawsuits. Right? We know that you're working really hard every day, day in and out, to keep your employees safe, to keep your customers safe. And the last thing we need to be faced with is some kind of frivolous lawsuit against your company that is push you out of business because of some not exactly best practices from someone to sue your company. So there's some solid legislation right now going through the committee process in Tallahassee. We're following it, we're supporting it very strongly, supporting the legislators that are bringing that forward. We'll continue to do that. We're confident that some good legislation will be passed in that regard, so you can have a little bit of peace of mind, so you can get back to running your business and not having to worry about that. I do thank you very much for being here today. I just love the fact that we do this once a month. We're starting to weave in some other in-person events. We went to the Successful Women in Business event, right? So we're weaving, yes, thank you ladies. I wish you'd let me go to those once in a while. Starting to weave some of those events in as well, but I can tell you that I am energized by this type of environment. I appreciate you very much for being here. And I'm going to end with this. So today, my mom and dad live in Delray Beach. They're frequent customers of the Delray Medical Center. Unfortunately, but when they're there, they get good care. My dad is 90, mom's 86. Today is their 71st wedding anniversary. 71st. So I only bring that up, not to recognize. That's a pretty cool accomplishment. But just to make sure that you all remember your sweetheart and make sure you take good care of her on Sunday. Maybe you too might get 71 years. Thank you very much for being here. Team Delray Med, thanks very much for sponsoring, and I'll turn it back over to you to get that. Thanks.
Thank you, Troy. For all those that are taking the red candy home, let that not be the only gift you give. Okay, I'd like to introduce our sponsor spotlight, Michael Nordis, Group COO, Palm Beach Health Network, CAO, Delray Medical Center. Mike Nordis has been named Chief Administrative Officer of Delray Medical Center and Group Chief Operating Officer of the Palm Beach Health Network, effective January 1st this year. He's a seasoned healthcare executive with considerable experience and growth and development as well as hospital operations. He joins us from Orange Park Medical Center in the Jacksonville area, where he served as a Chief Operating Officer for the past year and a half. Orange Park is a tertiary medical center with level 2 trauma services, and Mike led Orange Park through over $100 million in capital construction, renovation projects, through surgical and procedural services, through service line development and physical recruitment, as well as led improvements in overall hospital operations and throughput. Prior to that, Mike was the Assistant Administrator at Haywood Regional Medical Center in North Carolina, where he focused on throughput, operations, labor management, and productivity. He was promoted to Chief Operating Officer at Lake Norman Regional Medical Center in Mooresville, North Carolina. During his time there, he successfully launched an interventional cardiology program, led the facility through a number of development projects, and recruited physicians for key service lines. Mike began his healthcare career at Watertown Regional Medical Center in Wisconsin, where he held various leadership roles and overseen specialty areas. He also led many business development initiatives, including physician recruitment, service line strategic planning, and operations management. He's expressed that he and his family are looking forward to relocating to South Florida. I just learned he has 3 children, 2 in college, and he has 1 left at the house. He's excited about being a part of both Delray Medical Center and and the Palm Beach Health Network. Please join me in welcoming to our teams, Michael Norris.
Thank you very much. All of that just reminds me of how old home gets. So, really a pleasure to be here today. And I mean that sincerely. I think a lot of us were talking about we haven't been able to do these things for about a year. And I think it's so special for communities to be able to gather. So really appreciate Troy, Ivan, Boca Raton, Marriott, and Boca Raton Chamber of Commerce for putting this all together and doing it in a safe manner for all of us. It's really nice and enjoyable to be able to do this kind of thing. So happy to be here, and thank you for having us. So with that, good morning, and on behalf of the Delray Medical Center, thank you all for attending this event with us today. We're certainly honored to be a sponsor. And before I get started here, I just want to recognize a few members of our leadership team. If y'all could stand, and we're at a couple different tables, but just stand real quick. Raise your hand. Just want to recognize them. Such a great team to work with. Now, caveat here, like I said, I've been here 6 weeks. So normally, I'd have this all memorized for you, but I'm going to have to read it a little bit. But it is truly an honor. I can tell you in 6 weeks, you certainly can recognize the level of folks that you work with, both my colleagues at Delray and colleagues throughout the Palm Beach Health Network, and of course the physicians that we work with. It is a class above and beyond any that I have worked with, and I'm truly honored to be a part of that, and look forward to the amazing things that we will continue to do here. So appreciate that. Also, just want to recognize our two physicians who I'll introduce shortly, Dr. Rich Manning and Dr. Jeffrey Newman. So they'll be doing some speaking here in a little while, so we're excited to have them with us as well. So Delray Medical Center has long been recognized for quality care, being named one of America's 50 best hospitals. We pride ourselves in the commitment to patient safety. For the last 3 years, Healthgrades has presented us with the Patient Safety Excellence Award, which puts Delray in the top 1% in the nation. It's pretty amazing. Overall, for 2021, Delray Medical Center has earned 30 awards for clinical quality and excellence in cardiac, orthopedics, neurosciences, pulmonary GI, critical care, and GYN surgery. We have also been recognized by U.S. News and World Report as a high performer in the treatment of COPD and heart failure for the last 2 years. Delray Medical Center is one of only 2 level 1 trauma centers in Palm Beach County, each year seeing over 2,000 trauma patients. Being a trauma center means that Delray Medical Center has the highest level of physician expertise and training, enabling our team to deal with the most complex cases. At Delray Medical Center, we're committed to providing the highest quality health care to our patients, and we continue to invest in our facilities to incorporate the latest in technology. Over the next few months, we're investing over $5 million to enhance the experience we provide to our patients. This will include renovating one of our operating rooms, which will add an additional 800 square feet of space. This infrastructure will allow us to accommodate several general surgery procedures, as well as our new Da Vinci Xi robotic program. We're utilizing a new state-of-the-art technology called Indigo Clean, a continuous environmental disinfection technology. This ceiling light fixture uses visible light to disinfect and automatically, safely, and continuously kills harmful bacteria and continuously disinfects the air in hard and soft surfaces. We are also expanding the surgical waiting room area to accommodate our growth in surgical cases, to provide for enhanced social distancing, and to create a more comfortable environment for our patients, family, and friends. As you will hear today, Delray Medical Center is the area's leader in cardiovascular care. To support our growing cardiac electrophysiology program, we are relocating our EP services to our cath lab area. This new cath lab, what we call a swing room, will be able to perform cardiac caths, but also features peripheral equipment for electrophysiology procedures to be performed in the same area. This streamlines the process for the patient and the physician and minimizes the preparation time for the procedure. This addition will also include a new preparation for recovery area and a new transradial lounge complete with recliners for patients undergoing procedures. So with all of these advancements, Delray Medical Center remains committed to providing our community with the highest quality of care. And during these unprecedented times, it is even more important to remember not to delay care. Delray Medical Center is safe and open and ready to care for you. All right, so at this time, we are going to show a quick montage of recent media clips featuring our speakers today, Dr. Newman and Dr. Manning, explaining the importance of not delaying care, and especially for cardiac-related issues.
We all know nurses and doctors are working overtime right now. Medical professionals treating COVID-19 are extremely busy.
Dr. Bridgeshar Manny, an interventional cardiologist with Tenet Healthcare's Delray Medical Center.
So I think people are unfortunately dying at home, which is really very sad because these are all treatable conditions.
And as a cardiac surgeon at Delray Medical Center, Dr. Jeff Newman says myocarditis is becoming more common in COVID patients.
Be aware of your symptoms, especially after you've survived COVID, and make sure you see doctors sooner than later.
So I would not shy away from seeking medical care just because you're concerned.
Like Dr. Manny, most physicians are offering telemedicine right now.
And this is a device called the Vital Patch that people can put on for a week, and we know what your heart rate is, what your EKG looks like, what your pulse ox is.
As we see more and more patients who are post-COVID, we're seeing residual effects that we don't know about.
If you don't go to the hospital, you're having chest pains, you're having shortness of breath, or God forbid, you're having numbness in one side of your body. Time is muscle. Time is brain.
We'd love to see you in our offices, and hopefully with the treatments, including open heart surgery, which is available at our hospital, including the newer fangled technologies and a lot of research that we do here at Delray Medical Center, we'll find a treatment that best suits your needs.
In this uncertain time, Dr. Manny reminds hospitals are prepared to keep patients safe, so don't suffer at home.
Thank you. So such an important message from these experts, and we've all probably heard stories of people who either delayed care, waited a little bit too long, could have been treated, taken care of relatively easily. So please make sure your family members know if they have those signs, symptoms, things like that. So please come in and get care at the hospital. It's extremely safe from that perspective, and they're going to get great care there. So at Delray Medical Center, our cardiologists, cardiovascular surgeons, and endovascular surgeons work as a team providing the most innovative, highest quality care for our patients. This collaboration provides our patients with access to all of their specialists in one location and results in impressive outcomes. In the following video testimonial, Chuck Shore shares his story about the care he received from Delray Medical Center's heart team.
My name is Chuck Shore. I'm 75 years old. I'm a retired property and casualty insurance broker, now living in Delray Beach for the past 7.5 years. About a year and a half ago, I was diagnosed with aortic stenosis, and that's a death sentence.
So Chuck has a condition known as aortic stenosis. And aortic stenosis means narrowing of the aortic valve. That a normal valve supposed to open and shut like this becomes a pinhole. When somebody develops symptoms from aortic stenosis, the chance of dying in the next 1 year or so is upwards of 90%. The only way of treating this is to replace the valve. Traditionally, this was done by open heart surgery, where the patient would put on a heart-lung machine, the old valve would get taken out, and a new valve would get put in.
And now over the last 5 to 8 years, we're able to replace these valves with a transcatheter technique, literally threading the valve up from the groin and positioning it inside the old aortic valve without having to stop their heart or open their heart or put them on the heart-lung machine. They feel normal almost the next day.
So therefore we offer Chuck the option of undergoing percutaneous aortic valve replacement or TAVR. When we replace valves or implant new valves through the groin without the need for open heart surgery, these patients do at least as well as if they were going to do with open heart surgery. And in certain situations may even do slightly better.
It was a much easier procedure. It was a very quick recovery, simple, short and sweet. If you had to have heart surgery, it's the only way to do it.
TAVR is only one of the catheter-based technologies that we offer here at Delray Medical Center. We have a whole host of other technologies, including mitral repair technologies, such as the mitral procedure. We have other kinds of catheter-based technologies which are not even FDA approved yet.
We're also doing minimally invasive mitral valve transcatheter approaches.
We have, in my mind, one of the best multidisciplinary teams that there is. The whole team meets on a weekly basis. We discuss all our cases.
Everybody has put their egos aside and basically just looking at what's best for the patient. The patients get what procedure is needed for them, what's going to give them the best outcome and allow them to leave the hospital feeling better and not have to worry about their heart.
And the care that I was given here, if 5 stars is the highest, I give this hospital 10 stars. I felt like a king, and I was treated like one.
I think these technologies are going to continue to blossom. I think these technologies are going to provide better quality of life. I think these technologies will hopefully improve longevity.
No problems, no recurrences, and I have a completely normal life. The only thing that bothers me is the fact that I'm aging. But I guess that's a good thing. And I owe it all to Dr. Manny and his team.
All right. Wow, that is, as I said earlier, truly the care that is being provided here is world class. And I do mean that. I've worked with academic medical centers, and I would put these guys in Delray Medical Center and other Palm Beach Network facilities up against any hospital in the country. So such impressive work that is being done there. So fantastic. So now it gives me great pleasure to introduce these two, although I think with that video, we almost don't need an introduction, but let me do this. Dr. Bridge Manny is the National and Florida Medical Director of Cardiology for Tenet Health and a specialist in the treatment of structural heart disease. Dr. Manny leads a team comprising of cardiothoracic surgery, interventional cardiology, as well as echocardiography, which performs catheter-based cardiovascular procedures and have brought multiple new technologies to the region. He's also been instrumental in bringing percutaneous tricuspid valve repair technologies, including the TriClip device. The team has performed the first next-generation MitraClip cases in South Florida as a treatment of chronic mitral regurgitation. In addition, Dr. Manny specializes in percutaneous left atrial appendage closure with the Washington device, percutaneous transcatheter aortic valve replacement, or TAVR, which you heard about on the video as well. Dr. Manny is a clinical professor of medicine and fellowship director of cardiovascular diseases at the Charles E. Schmidt College of Medicine at Florida Atlantic University and has been on staff at Delray Medical Center since 2015. Also go ahead and introduce Dr. Jeff Newman as well. Dr. Jeffrey Newman is a highly skilled and experienced fellowship-trained cardiothoracic surgeon specializing in adult cardiac and thoracic surgery, mitral valve repair, minimally invasive aortic and mitral valve surgery, aortic aneurysm repair, surgical electrophysiology, and robotic and video-assisted thoracic surgery. Dr. Newman is certified by the American Board of Surgery and the American Board of Thoracic Surgery, and is a member of the American College of Surgeons and American Society of Thoracic Surgeons. Dr. Newman has been on staff at Delray Medical Center since 1996. Please join me in giving a warm welcome to Dr. Manny and Dr. Newman.
Good morning. You guys have your coffee? Fantastic, right? So, I cannot begin to tell you how delighted I am today with the greens that you saw, and I could dust off my suit this morning. And I really could find my fancy shoes. So, my wife was scrambled this morning at 6 o'clock, which is unearthly for me, not for him, 4 a.m. I've kind of come a little late to work, right? So, Michael, thank you for your kind introduction, and certainly delighted to be here. So, I like telling stories. How many of you folks have heard about Dracula? Everybody? Somebody? Dracula, for those who don't know who Dracula was this Eastern European guy who would kiss his loved one, would die, and that person would then become Dracula. So Dracula with his fangs coming out, his teeth coming out, red eyes. Remember that guy? Fast forward to the 18th century, everybody remembers those that died young. They were small, they were petite, with small feet, they were pale. Everybody remembered they could not be more beautiful than that 16, 17, 18-year-old girl who died. Everybody heard about that story? To the Johns Hopkins of the world, the Mayo Clinics of the world, do you know what they were? They were tuberculosis sanitariums. You know how cardiothoracic surgery came to being? Because we did not know how to open somebody's chest without killing them. So how people learned how to do surgeries, which is now popularly known as cardiothoracic surgery, was doing tuberculosis surgery by taking out a piece of the rib such that people with tuberculosis could breathe a little better. Right? Take out a piece of the lung without killing the patient. Translate it into this beautiful field of cardiothoracic surgery, which has saved countless, thousands, millions of lives, not only saved lives, but have made us live much better as human beings. Fast forward, we move away from opening somebody's chest. What we can do now with structural heart is do pretty much the same things that a surgeon would do with an open chest. We can replace valves, we can repair valves, we can do lots of crazy things. Now, a lot of these things are new. They are 8 years old, 10 years old, maybe 15 years old. Some of them, as Michael was saying, we have access to technology at Delray Medical Center that is not even FDA approved. We have access to technology that is known as early feasibility studies. Nobody's ever done this in the past. But guess what, at Delray Medical Center, what we do, we bring the patient in after informed consent to the FDA approved protocols. You replace their valves. And that's how technology improves. So at the end of the day, who do we have to give credit to? The good old Dracula. So, having said that, well, why is a cardiologist talking about strokes? Am I in the wrong meeting? Are you guys in the wrong meeting? It doesn't seem like that, right? And I'm going to go over multiple numbers here, right? But this is what I want you to really think about. How many people that you may know of, near and dear ones, who have atrial fibrillation? A lot. You hear about and see on television, Zeralto, Elvis, all these blood thinners, right? The blue pill, the pink pill, the yellow pill, I can't even remember. Patients come and say, doctor, that color pill, don't ask me. Maybe ask the pharmacist, right? But the issue here is people who have atrial fibrillation is the commonest cause for having strokes worldwide, not only in the United States. And if you have a stroke because of atrial fibrillation, your risk of having a recurrent stroke within the next 6 months is horribly high. How do we treat them? With blood thinners. What happens when you give somebody blood thinners? They don't do so well. You know how blood thinners came to be? It was rat poison. You have heard about Coumadin, warfarin, and those kinds of things, right? Why do we give rat poison to rats that are kill them? So we want to give rat poison to human beings? Well, guess what's going to happen? They're not going to do so well, right? That's why what we try to do. So what happens here is, moving away from the Dracula stages or the blood thinner stages from my perspective is, the most lethal appendage attached to any one of us are not our arms or our legs, is known as the left atrial appendage, which is where clots form in people who have irregular heartbeat or atrial fibrillation. So what happens to these clots? These clots break off and they wind up in the wrong spot. In the wrong spot, if that happens to be the muscle or bone where you have aches and pains, and kind of like, well, shrug it off, take more treatment. If it winds up in your brain, that's the end of the story. That's no good. So, how do we take care of this? So in 2005, there's more pictures of the appendage. That's the most lethal appendage attached to you guys. That's right here. So in 2005, we started with early feasibility studies to say, if we would cover this, and look at a little ball, that's a piece of clot. So we can look at these things in three-dimensional imaging, and we can say, aha, that thing is a time bomb. Once that thing comes out, we can't stop. That's when we press the button, the nuclear missile just took off. Right? We're done. So, how do we take care of this? By putting in a plug. How do I care what's on that side? I don't know. So that's two things, right? It prevents strokes, and at the same time, my patient does not need blood thinners. So rather than getting the shorter end of the stick, you got the longer end of the stick from both ends. You're not on blood thinners, but at the same time, you decrease your risk of having a stroke as if you were on a blood thinner. This is procedurally, I wanted to show you as to, we have fusion capabilities. We can marry CAT scans, we can marry ultrasounds onto other kinds of imaging, and we can really see inside the human body. That's how we can do these procedures without doing open heart surgery. I don't have any different kind of vision than what you guys have. So how can I do these procedures? Because of these technologies. Otherwise, it's not possible. Otherwise, you would have to just crack the chest open and do those procedures. So this, unfortunately, is going to move a little slowly. This gives you an example as to with imaging, with X-ray imaging, with ultrasound imaging, with CAT scan imaging, we can go ahead and implant these devices in the heart, such as to affect therapy, and the therapy in this case being to decrease the risk of stroke in patients who have atrial fibrillation, but the risk is very, very high. This is the most important slide from my perspective. Right? There's very few things in medicine that we do is improve longevity or decrease mortality. This small little piece, that puck, you might call it, or the cork, somebody else might call it, leads to improved longevity or decreased mortality. So a lot of people, maybe in this room, take Lipitor and Zocor and all those kinds of great things, and we swear by it, we live by it. Do you know how much decrease in morbidity and mortality Lipitor brings about? Only 25%. And it's a multi-billion dollar, trillion dollar business, right? This results in a better improvement, if you ask me, than even drugs like Lipitor. So I just want to share with you, we spoke about advances in therapy, how about advances in imaging? This is how we can see inside. These are live three-dimensional images inside the upper chamber in the heart, and we're doing a balloon procedure, cracking open a valve. And so the balloon is up right now. This is as good as it gets. That is how we can be effective in doing these procedures. These are yet again images. These are CAT scan images. We size these hearts. We look at their valves. Everybody's heart is different. So we have devices of different sizes. How do I know Mr. Smith is going to need this, Mrs. Smith is going to need this, and Mr. Jones is going to need something else? So you've got to make sure the sizing of these things is absolutely appropriate, because you're not looking at the valve with your naked eye. So how do you do that? By doing these images. So just keep going forward. You can do simulation, you can do all those crazy kinds of things, and these are the kinds of pictures in 4 dimensions you can look at the valve that we implanted. So just to give you an idea. And very, very high resolution imaging. So I'm going to quickly take you through a procedure as to how we can replace a mitral valve without cutting the chest open. These are not FDA approved technologies. We were part of the early feasibility study at Delray Medical Center. So just bear with me. Live in a human being, the patient's heart is beating, nothing is cracked open, and the valve is being put in, and it's very quickly going to start unfurling, and it's unfurling more. It's functional. So the amount of time it took me to take you through this 4 slides is the amount of time it actually takes to implant the valve. Obviously, there's a lot more information to see and all these things being very great. But nonetheless, isn't that beautiful? So when I'm 95 years old, don't crack my chest open. With a small little thing in my joint, maybe my wrist by that time, hopefully, give me a new valve, and I could go home the same day in 4 hours. That'd be great, right? Hopefully I won't need it. Hopefully you have it. But that's where we are. And it's beautiful. So I'm going to move on very quickly because this is important. So most of the valves that we treat right now are on the left side of the heart, the aortic valve that Dr. Moon is going to talk about, the mitral valve that we do treat. The right side of the heart is usually the forgotten side because we don't have very good technologies as of right now. So we are at the forefront of treating the right side of the heart with tricuspid valve trial and trial. And these are going to be still images, unfortunately, that a lot of color that you're seeing is the valve that's leaking tremendously. This person is not doing well, they have abdominal bloating, they can't eat, the kidneys are not functioning, they've got elephantine legs, and they're taking water pills, and they wake up 10 times at night, and life is miserable. So we go ahead and put this little clip on. It's an actual clip. See the amount of color that disappeared? This is beautiful. Now this person is going to feel better, going to decrease the amount of diuretics or water pills they're going to take, better quality of life. What we're trying to prove is that first, the technology does indeed work, number done these cases. And in the long term, they're going to improve longevity and survival and hospitalizations and so on and so forth. Now, this is the Chamber of Commerce. You guys know the numbers more than I do. Tricuspid valves, 1.6 million patients. Tricuspid replacement market was a $32 billion market. Look at that number, a year, 2006. It's 2021. This is I'm only talking about one valve, I'm not talking about the rest. There's 4 valves in the heart. This is a massive problem, not only from a business perspective, but from the amount of money that's lost. At the end of the day, it's all our money, it's the taxpayers' money that goes into taking care of these things. So with that, I'm going to give the podium to Dr. Newman. He's going to, I believe, talk about aortic valve replacement. So where we stand right now as physicians at Delray Medical Center in South Florida, we are bringing you the best of the best technologies with a lot of skill set, the latest and greatest that the Johns Hopkins and the Columbias and the Brigham and Women's and the Mayo Clinics have. We have all of that, if not more. So we are very happy, very proud of what we do. And Michael and Maggie, they've been extremely supportive of us, and we continue to serve our global population. Yeah.
That was a great talk by Dr. Manning. Appreciate it. Thanks everybody for having us. As my talk says, addressing untreated aortic stenosis, most common valve problem in adults older than 65 is aortic stenosis. And part of this talk you'll see is going to be, we're going to talk about surgical replacement of the aortic valve. We're talking about both TAVR, which is transcatheter aortic valve, as well as surgical replacement. 25 years ago, as I began my career in cardiac surgery, there was only surgical aortic valve replacement. And so as you see here, the population older than 65 is at least 37 million, probably more like 40, 50 million at this point. And a small percentage of those patients get treated with aortic valve replacement. And it's probably closer to 100,000 now because of TAVR and the penetration of minimally invasive techniques. And this graph is a classic graph that you learn in medical school, and I try to tell patients as they come to talk to us about why should I have my aortic valve replaced, either surgically or transcatheter. There's a long waiting period. And once patients start having any kind of symptoms, they drop off the life expectancy curve rather quickly, as you see on the right-hand side of that curve. And it's kind of exponential. So, as Dr. Manning alluded to, after symptoms, about 50% will pass within the first 2 years. And the guidelines are clear. When we talk about aortic stenosis, it's literally like putting your thumb over the end of a hose. Pressure builds up inside the pumping chamber, and the heart's under stress, and that leads to arrhythmia as well as heart muscle failure. So the green area is just showing us what the class 1 indications are. And in most patients that present in our clinics are asymptomatic, or they think they're asymptomatic. So there's a large volume of patients that are walking around that feel like they're just getting older and don't feel like they're having chest pain or short circuit to any significant degree. And this is just an older slide that shows you, in the green, it's showing how many patients being treated. I say surgical treated, that's both TAVR and transcatheter. It's really less than 50%. And it's getting better now because we have so many more options for truly minimally invasive without that broken in the chest. And this is an old study that shows if you don't treat patients with aortic stenosis, whether they're symptomatic or not, they will have about 22% risk of not surviving for the next 2 years. And again, this is as patients have presented to physicians' offices without real symptoms, very few end up seeing surgeons. And as we become more facile with transcatheter techniques, as we've opened up multidisciplinary approach, it's turning into this. Surgical evaluation meaning being evaluated at a valve clinic. So we're evaluating many more patients that have symptoms as well as asymptomatic patients. Most patients are seen by their primary care docs, And as the word has gotten out that we can actually treat the aortic stenosis without opening the chest, we're seeing more patients in valve clinics. And more patients are being exposed to the potential of treating the aortic valve. And the point of this is, in years gone by, no one used to get stressed. They had asymptomatic disease. They were just going about their daily life, especially as they got into the 70s, 80s, and close to 90s. But they've shown how patients who have progressive aortic stenosis and are asymptomatic, either they get stressed or we try to go through some sort of, activity scale, which is what we do, to see whether they're truly asymptomatic or not. And the real benefit of aortic valve replacement is, if you look at the green curve, that's whether they're asymptomatic or not. That's the life expectancy. There's definitely a divergence. Medically managing these patients leads to early death. And that's been proven over and over again, whether it's surgical or transcatheter. And this is, when we replace these valves, patients invariably get replaced on a more normal life expectancy. Whereas patients who never had aortic stenosis. And again, this is just mirroring the survival of patients who get treated with some sort of aortic valve. Red meaning those patients are not surviving as long as the patients over time. As well as medical cardiologists, interventional cardiologists, and that has exposed many more patients to the benefits of treating their aortic stenosis, whether they're symptomatic or asymptomatic. And I just want to say that I think at this point we are doing surgical aortic valves as well as transcatheter. Every patient has different problems. Not every patient qualifies for transcatheter aortic valve. That's why it really needs to be a multidisciplinary approach. I give their attention.
Can we give one more round of applause for Michael Norris? Thank you very much for Delray Medical for sponsoring this event. And everyone, thank you so much again for joining us today. We hope to see you at the next networking event. Thank you to Delray Medical for everything and anything since they're our local community hospital. Have a great Valentine's Day, and we'll see you all soon. Thank you so much.